Hi, my name is Shaini Narang. I'm an international yoga teacher and wellness expert. And join us for World Glaucoma Week from March 9th to 15th as our experts share vital insights and do's and don'ts on how to manage this sight threatening disease called glaucoma. So, doctor, one of my relatives recently got diagnosed with glaucoma. Is it something related to blood sugar or something else?
So, glaucoma is not directly related to blood sugar or hypertension or any other disease, but definitely uncontrolled diabetes or hypertension can lead to a special condition called neovascular glaucoma. But first, to get a general idea about what glaucoma is the end result of increased pressure within the eyes. So, what happens when pressure increases inside the eye? The millions of nerve fibers that are there within the optic nerve, that is the nerve responsible for our vision, these nerve fibers start getting damaged very slowly, one after the other. So, as this damage keeps on happening because of the increased pressures, the patient does not often realize that something is going wrong in the initial stages, because a significant amount of nerve fibers have to be damaged before the structural damage is actually seen. So, to give an example, if we take a big sack of rice, if we remove a single grain of rice from the sack every day, no one realizes that the sack is reducing in size till a large amount has already been removed after a lot of days. So, similarly, as long as the nerve fibers get damaged one by one slowly, no one realizes that there is any problem happening to them. Only when a significant amount of nerve fibers are already damaged, only then the patient might start seeing symptoms. And even in these symptoms, sometimes only the peripheral vision. So, when we look at an object, we are able to see what is surrounding the object also. We are able to see what is on the sides of the object, what is above and below the object. So, the peripheral vision starts getting affected first in glaucoma. So, to realize that there is damage acting in the peripheral region is very difficult for the patient. That is why glaucoma is often nicknamed the silent thief of sight. The damage that occurs happens over a long period of time and the patient does not realize that the damage is happening.
So, why does glaucoma happen to a person and can it happen to anybody?
Glaucoma is basically the tendency of the person itself or of the eye itself to have. It usually does not happen because of a person doing something or not doing something. We are talking a lot about pressure inside the eye. What is this pressure? To understand it, the eye is like a ball. So, to maintain the structure of the ball, let it be a basketball for example, there has to be some air inside it to maintain the structure of the ball. Similarly, for the eye, there has to be some fluid inside the eye which maintains its structure and in its shape. So, as long as the pressure remains within the normal range in the eye, it does not cause any problems. But when this pressure increases, that is when the nerve damage starts happening and that is when glaucoma happens.
Doctor, how will I understand if I am suffering from glaucoma?
Glaucoma in its initial stages is very asymptomatic. What happens is few very perceptive patients in the initial phases sometimes complain that they have some headache or that there is some heaviness over the eyes or in the brow region. Few people say that very perceptive if they say that they are not able to see the sides of their vision. Especially during driving. Once it comes to advanced stages, it is easy to make out. But in driving, people say that they are not able to see vehicles which are overtaking them till they come in front of them. So, these are the few symptoms of earlier stages of glaucoma. Coming to advanced stages, patients do notice that they have reduced vision or blurring of vision. One thing we have to remember is when there is a high acute spike of IOP, that is when the pressure rises very suddenly, as we see in cases of closed angle glaucomas, the pressure increases. So, what happens is there is fluid accumulation within the cornea. The vision reduces suddenly. It is usually accompanied by pain and redness of the eye. Sometimes there might be nausea and vomiting. In these situations, the patient has to consult a doctor immediately and seek medical attention to avoid permanent damage to the eye.
Doctor, if someone is suffering from glaucoma, what type of medicines would you suggest?
Usually, once we diagnose glaucoma or once we have a suspicion that glaucoma is present in the patient, we evaluate what the baseline pressures are for that patient. Then we investigate the amount of glaucoma damage or nerve damage that is already there in the patient with the help of some tests like visual fields and optical coherence tomography. And then we also see for some coexisting eye conditions which will influence our management of glaucoma like cataract or any other retinal pathologies. Once we have evaluated all these, what we do is we establish a target pressure which is different for each patient dependent on their eye condition. So, to achieve this target pressure, we start the patient on some medications or eye drops to reduce the pressure. Then we see how the patient is responding to these medications, and based on that we tailor the dosage of medications, increasing them or decreasing them as required. Sometimes we suggest laser procedures or sometimes even surgical management to reduce the pressures which are there in the eye, which will help prevent the progression of glaucoma.
So doctor, for how long one has to take the eye drops?
Glaucoma is a progressive disease, it is a chronic disease. Just like diabetes and hypertension, once glaucoma comes, it stays with us lifelong. It does not leave our sight. So, the patients will need to use therapy lifelong. But there are some options now, laser procedures and some minimally invasive glaucoma surgeries which are available, which do reduce the burden of eye drops, but you are not completely cured of glaucoma. We can only manage it accurately.
I have a very important question. Can glaucoma cause blindness?
Yes, glaucoma is one of the most common causes of irreversible blindness in the world and in India also. Irreversible blindness. This term, what it means is that once the damage due to glaucoma, whatever occurs in the optic nerve, it cannot be reversed. We can only do all the treatment to restrict the amount of damage and maintain the vision at the level where we have diagnosed it. So, if the patient takes treatment regularly, comes for regular follow-ups, we can maintain their vision at the level where we have seen them, and the patient has to follow through with this treatment lifelong.
As you told, lifelong medicine is required. But the question is, will it cause any side effects?
Like all medications, even glaucoma medications will have some side effects like redness, causing watering of the eyes. Some people complain of some gritty sensation in both the eyes. They feel as if there is some sand inside the eyes. Few people have complaints of hyperpigmentation or darkening of the skin around the eyes. So these complaints again vary from person to person. Few people just say that they have redness for 5 to 10 minutes after putting the drops. For few patients, this may continue for 1 or 2 hours, and in few dryness symptoms might be more. And some people do have frank allergic reactions to these medications also. But important thing to remember is, do not discontinue the medications because they have these side effects. Please come back and discuss with your doctors so that we can reach a solution to these problems and tailor make the dosage which according to your needs, so that long term use of these medications is possible. And nowadays we have lots of combination therapies. What is combination therapy? We combine 2 or 3 drops in the same bottle so that the number of dosages of eye drops is reduced. And we do have preservative free medications which are softer on the eye.
So doctor, is it like one eye drop is sufficient to manage glaucoma lifelong?
Glaucoma is different from person to person. In each person it behaves differently. So yes, for a few people even with one medication we might be able to manage their glaucoma better, but few people do require multiple eye medications and multiple doses in a day to manage their glaucoma. However, with newly available combination therapies and the newly available minimally invasive glaucoma surgeries that are there, we can definitely reduce the burden of medications and make sure that it does not become a burden on the patient.
As a common person, What should I do to prevent or manage glaucoma?
So glaucoma is something that cannot be prevented. Glaucoma can only be diagnosed early and treated at the stage where we diagnose it. So for this, we need to remember few important things. Number one, whoever is over 40 years of age needs to come for a glaucoma checkup regularly. That is, at least yearly once you have to be evaluated for glaucoma. Especially those who already have a family history of glaucoma, first degree siblings, first degree relatives having glaucoma are at a higher risk of developing glaucoma. So they should be very careful and come for regular checkups even as early as 30 years of age. The second thing to remember is adopting a healthy lifestyle not only provides good eye health, but it is good for the management of glaucoma as well. When we are talking about healthy lifestyle, it is important to include antioxidants, vitamin C, E and E rich foods in our diet. The second thing is exercise. Simple cardio exercises like walking, jogging and cycling have been known to reduce the pressures by at least a few millimeters of mercury, which is helpful in managing the glaucoma. The third thing is there are few things to avoid in glaucoma, especially exercises like Shirshasana, in which the head goes below the heart, and certain weightlifting exercises where the breath, if the breath control is not proper, the pressure inside the eye can rise. Then few other things to avoid in glaucoma would be drinking more than 1 liter of water at a time, which can increase the eye pressures. Other thing would be to wear tight neckties. This also can reduce pressures in the eye. So simply by following these do's or don'ts, we can help to manage glaucoma better but not prevent it completely.
So by chance, if a patient misses one drop, will it impact? And how can one avoid missing dosages?
So to put it in a context, if we miss one dose of diabetic or hypertensive medication, definitely the sugar or the blood pressure will rise for that particular single day. Similarly, when we miss a dose of glaucoma medication, the eye pressure will also rise during that time when it is supposed to act. So these fluctuations are very difficult to manage in glaucoma and they cause definite progression of damage within the optic nerve and progressive visual field loss. So we have to avoid missing doses of glaucoma medications as much as possible. For patients, I give them simple tips like they can put alarm clocks or reminders on their smartphones to remind them to use medications on the correct schedule. Few people find that they can use cues, so they include their day-to-day activities and link them along with the glaucoma medications. So say a person is watching news in the evening at 9 o'clock, they remember to take their medication along with the evening news so that they don't forget to skip doses. And people who prefer pen and paper make a schedule and they try to stick to the schedule by ticking off medications as they apply them. For tech savvy people, there are a few apps which will help you remind the correct medication schedule and dosage so that you don't miss them.
Thank you so much, doctor, for sharing your valuable insights. I'm sure it will be very beneficial for our audience.